First Lady, Merck Foundation leadership, all dignitaries, protocol observed. Good morning. My name is Dr. Mokgweetsi Eric. I am a family physician. I completed my diploma and MSc in diabetes management through the University of South Wales, thanks to Merck Foundation scholarship. Since completing these courses, amongst other things, I have been able to share knowledge and transfer skills to doctors and other healthcare professionals in my district through in-service lectures and workshops. I've also had the opportunity to be invited as a speaker for the last year's Merck Foundation Health Media Training. I have gained in-depth knowledge from my studies. I feel confident in what I do, be it training colleagues or consulting patients. I'm able to consult complex cases. With the knowledge I gained through my studies, I have reduced the need to refer patients to referral hospital, as I can manage most of these cases in my district, therefore reducing cost burden on the government. The community is greatly benefiting from my training as I give them quality medical care. This means fewer diabetes complications and halting progression of the complications. From my training, I continue to advocate for my patients to get modern diabetes medications. All this leads to improved health outcomes and satisfied customers. Lastly, I would like to thank Merck Foundation for the scholarship. This educational opportunity would not have been possible without your generosity. Thank you.
It is such an honor to stand before you today as an alumni of Merck Foundation. This organization has been instrumental in my educational journey and my professional development. In 2021, I had the opportunity to enroll in a postgraduate diploma in sexual and reproductive medicine at the University of South Wales. This course equipped me with essential knowledge and skills, which significantly enhanced my ability to perform my job. At the time, I was working in a semi-rural area where there were limited resources for consultation. The diploma laid a crucial foundation in matters of sexual and fertility medicine, allowing me to provide better care and support to my community. Having been successful in my pursuit for the diploma, I felt encouraged to further my studies. With the continued support of Merck Foundation, I applied for a Master of Science in Sexual and Reproductive Medicine at the same university. I was fortunate to be granted this opportunity and successfully completed the program in January 2023. This advanced training not only deepened my expertise, but also improved my day-to-day consultation and overall professional confidence. Apart from the acquired knowledge, the Merck Foundation has significantly boosted my confidence to pursue a field of great importance to me. I am currently studying for a Master's in Medicine, Obstetrics and Gynecology at the University of Botswana. The high-level education and training I have received has prepared me very well for this current endeavor, and I'm immensely grateful to Merck Foundation for that unwavering support. Thank you to Merck Foundation for believing in me, and all of you for being part of this incredible community. Together, we can continue to advance the field of sexual and reproductive health and make a positive impact on the world. Thank you.
Her Excellency, the First Lady of the Republic of Botswana, Merck Foundation leadership, all dignitaries in the house today, I greet you all. My name is Dr. Lorato Sopani, and I'm a Merck Foundation alumni, class of August 2022. I enrolled in postgraduate diploma in endocrinology, and I remain deeply grateful to Merck Foundation and the Ministry of Health for the opportunity. The content of severe shortage of endocrinologists in both the private and the government sector in the country cannot be cannot be understated. And for a general practitioner like me in a district hospital to have gain insight information in the chronology has served a great impact in my community. So there was, because of currently there are 3 endocrinologists in the government sector and 5 endocrinologists in the private sector. So thanks to Merck Foundation, I'm amongst the 3 in the government sector. And this goes without saying that the burden has been so much in the specialist for the referral of the patients, and also the implication of mismanaging and misdiagnosing the patient. So upon completion of my study, I was more competent in managing endocrine conditions, and also through in-service training, I was able to share the knowledge with my colleagues. And through that, there was a great reduction in the referral to specialists, and also an improved care in the patient health system overall. So during my journey with Merck Foundation, I found a gap in research, and that has encouraged me to enroll in public health medicine with the University of Botswana, the course that I'm currently pursuing, to try and close the gap in research. So in conclusion, I wish Merck Foundation to continue with the scholarship with the oncoming students, so to continue as an attempt to amend the critical strategy of specialists in the country. Thank you so much.
Her Excellency, Madam First Lady, Merck leadership, all dignitaries, protocol observed. Ladies and gentlemen, a warm welcome and good morning to you all. I am Oni Steven, a medical lab scientist, also a clinical embryologist, currently employed by the Ministry of Health. As one of the beneficiaries, I am grateful for the opportunity I was offered to study biotechnology of human-assisted reproduction and embryology at Manipal Academy of Higher Education in India, which is a new profession in the country. And as a passionate clinical embryologist, I must say I am well equipped in the field of reproductive medicine, and I'm ready to utilize my skills. It is imperative to note that these technologies are scarce, especially in low and middle income countries. Ladies and gentlemen, efforts are underway for collaboration opportunities to establish a local in vitro fertilization, that is IVF center for treatment of infertility, as data have indicated the need for these services. And through conversing with some affected people, I noticed infertility has negative social impacts in their lives, especially women who frequently experience social stigma, shaming, violence, and divorce, resulting in negative emotions such as depression, anxiety, and low self-esteem, since motherhood is considered a rite of passage for women. But this is due to lack of knowledge, failure to understand that infertility is a medical condition affecting both males and females equally. Therefore, establishment of a local center will not only reduce stress, but will also alleviate the cost associated with seeking IVF treatment services outside the country. And for a seamless establishment of this center, input is also required from relevant key players. Together, we can help to change the narrative, as infertility is not a cosmetic service, as commonly classified. Merck, I will forever be grateful. Thank you.
Your Excellency, the First Lady of the Republic of Botswana, Merck leadership, dignitaries here present, let me stand on the established protocol. Good morning. My name is Dr. Tirimalo Okami. I'm a specialist family physician, and let me say that I am very, very proud to stand here before you today because of the passion that I've had for respiratory medicine. I think we all come from a background of COVID, and even prior to that, I had really looked forward to studying chest medicine. The sponsorship that I received from the Merck Foundation set a tone for me, where currently I have now leading a clinical team in the district in Tlokwe. And through that team, we have been able to strengthen the prevention, the treatment, and the diagnostics of respiratory conditions. And through that team, we have been able to now try and actually strengthen and build capacity just outside that one district, but also to extend it into other districts. We have also forged relationships and stakeholders meeting with some of our partners, both in private and public. One of our key engagement was with Princess Marina, and we have now even gone beyond what we started off with, and we are now offering capacity just beyond respiratory medicine. We are now even doing ear, nose, and throat services within the district. One of the remarkable outcomes that we have so far received was the positive feedback from the community members who used to seek those services outside the district. And as a clinician, I can tell you it is far more rewarding when your patient in front of you is very happy and acknowledges the efforts that you have put in order to try and reduce the cost of seeking health services. Unfortunately, on the goals that we have set, for me personally and for my team, we are not yet where we want to be, and hopefully through our advocacy and through Merck Foundation sponsorship, through the Ministry of Health support, we should be able to establish a robust and resilient respiratory medicine program within Botswana to ensure that we are resilient if we are to face another pandemic like COVID. I'm sure today all of us here are well aware of my PS's primary healthcare revitalization strategy, and I hope that through that strategy, we should be able to ensure that respiratory medicine is one of the covered areas and it is not left behind. Ladies and gentlemen, I'm very grateful for the opportunity that I've been given, and let me once again thank Merck Foundation for the opportunity that they have given me, and let me also encourage them to continue in the advocacy for healthcare and capacity building. It is a journey that I'm very proud to be part of. Thank you.
Your Excellency, the First Lady, Merck Foundation leadership, all dignitaries, protocol observed, good morning. As already introduced, my name is Patricia Rantabeng. Professionally, I'm a scientist in the Department of Pathology, University of Botswana. I was awarded a Research in Oncology Fellowship under the Merck Foundation Cancer Access Program, totaling 6 months of study at the Tata Memorial Hospital in 2017 in Mumbai, India. My training was mainly focused on acquiring skills in molecular pathology, whose application to cancer research was still at infancy in our institution then. I've since graduated with a Master of Philosophy in Medical Sciences degree, and as of March 2024, I'm a Certified Associate in Project Management. I have been promoted and currently overseeing academic research activities in my department, in addition to supervising post and undergraduate student research, mentoring junior researchers as endorsed by the Dean of the School of Graduate Studies. The highlight of my research journey since the fellowship is leading a cervical cancer screening project targeting 171 women from the indigenous and marginalized communities of Kalahari and Kante districts in Botswana. The aim of this project was to determine cervical disease burden, associated risk factors, and barriers to participating in health screening exercises. Our project was successful, reaching 258 women, whom we also educated on the benefits of participating in health screening exercises and following up with their results to enable timely commencement of treatment of those in need. In conclusion, I would like to express my gratitude to Merck Foundation for acting as a springboard to my career development and for positively impacting the communities we serve. Thank you.